On June 30th, Oklahoma's health department announced that the West Nile virus had claimed its first human life of 2022. The Oklahoma News Report's Steve Shaw talked to an Oklahoma City woman who nearly died from a West Nile infection 9 years ago. Steve?
Jason, there were dark days when severe headaches Kristen Adams suffered from back then turned into something else. She says if you spend any time outdoors, you simply can't take anything for granted. Kristen Adams lives a busy yet quiet life in Oklahoma County. She says news of the Sooner State's first West Nile death of 2022 took her back.
I contracted West Nile with encephalitis, and spinal meningitis kind of followed through with that. But yes, I feel very lucky to be here.
In August of 2013, Adams was preparing for a float trip in Tahlequah when she got really sick.
And then just a pounding headache in the back of my head, and everything was just really fuzzy, and it was hard to walk to the car, and then they took me to the hospital. And then Tahlequah did a spinal tap on me, and they really couldn't get a proper diagnosis. So they ended up transferring me to Mercy in Oklahoma City, and that's where I got the proper care that I needed.
Jolianne Stone is a state epidemiologist and says this latest death occurred in central Oklahoma.
We first saw West Nile virus in the United States back in 1999, and we saw it spread across the country. And the first year we started tracking it here in Oklahoma was in 2002.
The worst year for West Nile here was 2012, when 15 Oklahoma residents died from the illness. 161 others reported getting sick.
We see variations in the number of cases of West Nile virus that we see each year. Mosquitoes, such as the Culex mosquito that transmit this particular virus, it really likes what we would think opposite of most mosquitoes. So it likes those drier temperatures. It can survive in very, very small amounts of water, and it also likes to live around where people live. So it's different than what you would typically think, like in the springtime, all the rain and the mosquitoes. Those aren't the type of mosquitoes that carry this virus. It's the ones that you typically see in the morning and in the evening, and typically in the drier parts of the year.
Stone says there's no cure for West Nile. The illness just runs its course, usually in less than a week.
The symptoms can be, most people actually have no symptoms of West Nile virus. Some people that do develop symptoms may have more mild symptoms, so fever, muscle aches, just kind of achy feeling. But then again, some individuals who may have other comorbidities or other conditions such as diabetes, or maybe they're a little bit older in age, they're at highest risk for those more severe type symptoms.
You feel it inside.
Kristen Adams was hospitalized for several days back then.
It took me a good year and a half to fully feel a decent energy level again, and just daily tasks, being able to complete them. And then cognitively, I think, if it does get into the encephalitis stages with the West Nile, I think that it takes a while. It took me quite a while to feel back to myself.
And it's not just humans that can be affected by West Nile. It's horses, too. Justin Talley is department head for entomology and plant pathology at Oklahoma State.
Horses and humans are what we call dead-end hosts, and because this virus is transmitted by mosquitoes feed on birds, then they feed on either humans or horses, and that's how West Nile virus is transmitted.
Talley says there's now a West Nile vaccine for horses, and as long as they get one along with a booster each year, the virus won't touch them. Why doesn't it affect cows?
Well, it's interesting. Cows and how the virus can interact and how the mosquito interacts with those cows is just not a very good host.
So the key to stopping West Nile is to kill as many Culex mosquitoes as you can. The state epidemiologist tells me city-county health departments in Tulsa and Oklahoma City have mosquito abatement programs. An Oklahoma City spokesperson tells me their crews drop larvicide dunks in area streams and standing water. The state health department promotes this webpage that has several tips, such as simply emptying out your pet's water bowl each day, scrub and refill bird baths once a week, and empty wading pools each week and store them indoors.
Well, I will say we're kind of early on in the season, so when we heard about this death that was related to West Nile virus, we're not seeing that related to horses yet, and we're not really seeing it related to the mosquito population yet either.
But it's coming.
Yeah, more than likely.
The reason why we as public health officials want to let people know when there's been our first case of West Nile virus or our first death of West Nile virus in the state is because there are things that individuals can do to help protect themselves from getting West Nile virus. And again, that's going to be those 4 Ds. That's going to be avoid dusk and dawn, dress appropriately, wear DEET, and then also drain standing water because these insects, these mosquitoes do multiply in just small amounts of standing water.
Again, there's no human vaccination for the West Nile virus. Stone says if you develop symptoms, you should be okay in a week.